Right. Thank you everyone for joining us today. Very excited to have you all join in on this lecture for Heart Month. My name is Megan Yuan. I'm from the Capitol Health Community Health Education Department. And before we get started, I just want to go over a few housekeeping items. Firstly, should any technical difficulties occur, we do appreciate your patience and understanding as we work to quickly address them. Secondly, please mute your microphone to help keep the background noise to a minimum. Make sure you mute your microphone when you are not speaking. And remember that the private chat box is never fully private, so just be aware of what you write in the chat box. And also, I have a SurveyMonkey link here for the evaluation, and that's for everyone to fill out at the end of the lecture. So I'll be reposting that link again. You can find that in the chat box. So lastly, all questions will be addressed at the end. If you do have a burning question, please just type it into the chat box and it will be addressed later on after both lectures are complete. Now, I would like to introduce both of our speakers today, Pamela Swiernik and Laurie Beck. Pamela Swiernik is the Cardiology RN Outcomes Coordinator for Capitol Health. In this role, she oversees implementation and integration of national standards and evidence-based clinical practice guidelines in the care of cardiac patients. In her previous role, Pamela was a performance improvement analyst in the Department of Quality and Patient Safety in Capitol Health. Her responsibilities included support of multiple evidence-based performance improvement initiatives for the surgical service line, including early recovery after surgery and the American College of Surgeons Surgical Registry database. Pamela's background includes extensive experience in critical care nursing and management, conflict resolution, hiring, developing, and evaluating nursing staff. She has graduated with a Bachelor's of Science in Nursing from Grand Canyon University, and she holds a certificate in supervisor leadership from Penn State University and a national certification in critical care nursing, in addition to the ACS Surgical Care Review certification. Our second speaker of tonight, Laurie Beck, graduated from Temple University with a BS in physical education and from Thomas Jefferson University with a BS in nursing. She started her career in cardiopulmonary rehabilitation in 1989 at Lower Bucks Hospital in Bristol, Pennsylvania. She joined the team at Capitol Health in 1993 and has been in cardiopulmonary rehab since then. She is an active member of the American Association of Cardiovascular and Pulmonary Rehabilitation, and she is currently a department supervisor. So without further ado, I'll turn it over to Pamela.
Hello, everyone, and thank you for joining us and giving us the opportunity to talk to you about these very important topics. I'm going to be talking to you about early heart attack care. My objectives for my talk tonight are to talk to you about the early signs and symptoms of heart attack, to talk about the risk factors for heart attack, to discuss the differences in symptoms between men and women, to discuss the importance of recognizing the symptoms and then responding to them. And then there is an Ehack Pledge, or Early Heart Attack Care Pledge, that we will all read together at the end. And you'll hear me use the term Ehack a lot tonight, and that stands for Early Heart Attack Care. So what causes a heart attack, and why do people die from them? The heart is a huge pump. It does a lot of work making sure that your blood is pumped all the way through your body, and it needs its own steady blood supply in order to work and to survive. There are three major blood vessels that supply blood, which supplies oxygen to your heart. And when a blockage occurs, it interferes with the blood supply, and then your heart no longer is getting the oxygen that it needs, and this blockage could possibly cause heart damage or even death. So how does a blockage occur? A disease called atherosclerosis, or hardening of the vessel or an artery. I'm sure you've heard of atherosclerosis. lifestyle choices that we make often are known risk factors that can cause atherosclerosis, such as things that can cause us to have high blood pressure, high cholesterol, or smoking. And these things cause plaque to build up in a vessel over time. And then eventually what happens is that this plaque will break off, and it's going to cause a clot to begin to form to heal over the area where that plaque broke off. And then this will then close the artery. You have chest pain because this artery is closing because of the plaque buildup. And now the blood is not able to flow, and this artery is not able to get the oxygen that it needs. And the pain is a sign that your body is saying, there's something going on here and we need help fast. We need to address it. So early heart attack education teaches you to recognize the early signs and symptoms of a heart attack. Each year in the United States, about 750,000 people have heart attacks, and of those, about 116,000 people will die. Many of these patients experience early symptoms. Someone might have one or more of the common symptoms of a heart attack, and when they start, they can be mild, they can come and go. Over time, the symptoms and the pain become more intense, and they become harder to ignore. But you have to stay alert and always pay attention to chest pressure and chest symptoms. This education is meant to, again, share these early signs and symptoms of heart attack, and just to make you more aware that they may include signs and symptoms that you may not always associate with a heart attack. So here are the different things that someone who's having a heart attack may experience. They may feel a feeling of fullness. They may have pain that travels down one or both arms. They could have pain in their jaw. They may feel very fatigued or weak. They may be experiencing anxiety. They could be nauseous or vomiting. They could have back pain. They may be short of breath, and they may have the classic chest pressure, squeezing, aching, or burning. Chest pain that is associated with a heart attack often gets better if you lie down and rest, but then gets worse with activity or exertion. So this is one way to distinguish heart attack related pain from other types of pain. The key to surviving a heart attack is to get medical attention as fast as you can. So our slogan for tonight, one of the main takeaways is survive, don't drive, call 911. Don't hesitate. If you or someone that you're with is experiencing any of these signs and symptoms, if there's any question, call 911. Heart attacks, like other diseases, have early signs and symptoms, and these beginnings can occur in 50% of patients. And if they're recognized, people can be treated before the heart damage occurs. Just like if a friend told you, oh, I found a lump in my breast and it's new, you would advise that person to seek treatment. You would say, that's a new finding, you need to get that checked out. Heart attacks are the same way. You don't want to ignore these signs and symptoms. You want to act as soon as you recognize that this could be possibly happening. Heart damage can range from mild heart damage to severe, and it can be very limiting to your life. People can survive heart attacks, but have crippling heart disease that really limits the things that they're able to do. And of course, as we all know, and as we talked about earlier, it can lead to death as well. So early detection is key to preventing death or severe heart damage. Ehack, or this early heart attack care education, can help to reduce the mortality rate associated with heart attacks. You want to become an active bystander so you can save a life, even if it's your own. or especially if it's your own. There are 3 different ways that a heart attack can present itself. One is one that people think of immediately, and that's a heart attack that stops you in your tracks. And you may see someone, or you may feel yourself such crushing pain, and you may fall to the ground, or you may see someone doing that. People call 911, and the key would be to begin CPR immediately. CPR classes are not necessarily necessary in order to perform it. What people need to remember is to push hard and fast after someone has called 911. This is the type of presentation that people think of the most when they think of heart attacks. There also is the type of heart attack that presents itself that's more of a pressure, and people will say often, I feel like there's an elephant sitting on my chest. But even then, they may experience a little bit of denial, and they may be reluctant to seek medical attention. This is when it's important to encourage them to either call 911 or get to an emergency department. And then there's the beginning of a heart attack. This is the most difficult time to get someone to seek medical care. People ignore their symptoms. They think, oh, it's indigestion. I may have a burning in the back of my throat that's not going away. It must be just something that I ate. But if there is any chance that you think that it could be related to a heart symptom, then you want to go to the hospital and have it checked out. So I want to talk about risk factors for heart attacks. A lot of people may have one or more of these things, and it's important to know that if you experience any of these things, then it does increase your risk for heart attacks. If you've ever had chest pain or pressure or burning or aching or tightness in your chest, or if you have a known family history of cardiovascular disease, that is also a risk factor. If you've been diagnosed with high blood pressure, if you're overweight or obese, if you have a sedentary lifestyle, you are at increased risk of heart attack. If you use tobacco products, if you have a metabolic disease such as diabetes, that also increases your risk of heart attack. For women, if women have ever had gestational diabetes, or if they took birth controls, or if they have a history of preeclampsia or having a baby that had a low birth weight, these things also increase a woman's risk for heart attack. Men typically will have classic signs and symptoms of heart attack. Women sometimes feel or experience their symptoms a little differently. So we always want to keep in our minds that this is a possibility, and we want to be evaluating, do we think that this could be a heart attack? Men may feel pain and numbness in the left arm or the left side of their chest, but women often have these symptoms on their right side. Women who've had heart attacks often say that they felt completely exhausted or drained or dizzy or nauseous. Women also feel pain in their upper back, and it travels into their jaw. And women often think that their stomach pain or discomfort that they're having during a heart attack may be caused by the flu or heartburn or an ulcer. And then there are atypical presentations or presentations that are different than the norm. And that could be a sharp or knife-like pain that occurs with coughing or breathing, pain that spreads above the jaw or even into your lower body, or difficulty or labored breathing. So the key is to recognize these early signs and symptoms of heart attack, respond by getting the person to care as soon as possible, whether that's yourself or someone that you're with. And if you feel these symptoms coming on, you want to call 911. Survive, don't drive. Our emergency medical response team would much rather pick someone up and get them to the hospital and find that they are not having a heart attack than to miss even one person that is. Capitol Health Hopewell Campus is an accredited chest pain center, accredited by the American College of Cardiology. It has been a chest pain center since 2013. I'm going to go back one moment. I just want to say that one of the things about being a chest pain center, what it means is that the employees that care for people at Capitol Health have all been trained so that they know that if a patient arrives in the emergency department or is a patient in our hospital on the floors and they complain of chest pain, then there are protocols in place and they're standardized. They're an efficient, effective way of starting a cascade of events that we are doing in a timed fashion. We know that if someone walks through our door and they say, we're having chest pain, we want to have an EKG done within 5 minutes. We want it in the physician's hand so that it can be interpreted within 5 minutes of being completed. And then if that physician feels that the patient is having a heart attack, they're going to activate the system that activates our cardiac cath lab. So that way, whether the team is already in-house or they're outside of the building, that it mobilizes everyone in a very timely, standardized way. And we practice this. And because we monitor these measures and the metrics to make sure that we're training our staff and meeting these measures, that is why we have been able to maintain our accreditation as a chest pain center since 2013. Most of the damage that occurs from a heart attack can occur within the first 2 hours. So Ehack really encourages you to know the subtle signs of a heart attack and act on them before heart damage occurs. It's definitely better to be able to intervene early on when a heart attack is happening, because we have a better chance of acting before much of the heart tissue has been damaged from a lack of oxygen. We can't really talk about anything related to healthcare without discussing COVID-19. So what I want to tell you all is that hospitals across our country are taking steps to prevent exposure to any patients to coronavirus, and Capitol Health is doing that as well. Because for heart problems, every minute counts. Time is muscle. So we want patients to feel that if they're experiencing any issues, that it is safe for them to come to the hospital and be treated. So at Capitol Health, what we're doing to keep our patients safe, we are testing and screening patients and staff members. We are using masks and protective equipment. We do thorough cleaning and disinfecting. We are practicing social distancing, and we practice frequent hand washing. So as a reminder, don't ignore your heart symptoms, especially if you have a known heart condition. Getting care is critical. The faster you get care, the faster you'll be able to heal and get better, and you'll limit the damage to your heart. So whether you're having chest pain and difficulty breathing or discomfort in your chest or arms and you're concerned about a heart attack or stroke, which is another cardiovascular disease, which would be numbness or weakness or loss of movement in your face or leg or arm, or a new onset of confusion or trouble speaking, call 911. If you think you could be having a heart attack or a stroke, it's so important to activate the emergency medical services team. They can begin treating you as soon as they arrive. They have oxygen. They can activate advanced cardiac life support to come to the scene to give more medications. Basic life support and advanced cardiac life support, they have the ability to do an EKG right there. So the care begins immediately, which is the benefit of activating EMS or calling 911, because it allows your care to begin right away. And they can transmit an EKG to the emergency room doctor. That doctor can activate the team to say, someone is on their way in, we think they're having a heart attack, and you need to come in so that we can get them into the cath lab. It just begins the cascade of events sooner, so that with the goal always being that we can intervene as quickly as possible to limit the damage to your heart as much as possible. So this is the Ehack Pledge that I had mentioned to you. I'm going to read it out loud. If you will read it along with me, you can say it out loud or just read to yourself. But it's just really important to hear the words and know that if you take this pledge and act in this way, you could save your own life or someone else's. So the Ehack Pledge says, I understand that heart attacks have beginnings that may include chest discomfort, shortness of breath, arm pain, and weakness. These may occur hours or weeks before the actual heart attack. I solemnly swear that if it happens to me or anyone I know, I will call 911 and activate our emergency medical services. If you take only 3 things away from this part of our lecture, I want you to remember that heart attacks have beginnings. And that means that the symptoms can begin up to 2 weeks before a major event. And the window of opportunity to prevent death and minimize damage is in that early phase. The earlier we intervene, the more effective we'll be in preventing death or serious damage. Every year, 750,000 Americans have a heart attack. And if you think someone is having a heart attack, get them to medical care as soon as possible. Survive, don't drive. Call 911. It's so important that that care begin as soon as possible. The American College of Cardiology they are the sponsors of the Early Heart Attack Care Program, and you can find information at deputyheartattack.acc.org, and there is just a lot of information there about signs and symptoms, what to do if you or anyone you know is experiencing them. This is a wonderful website that anyone can go to. I would encourage you to do that. I want to thank you all for your attention and participation. And after Laurie has talked to you about cardiac rehabilitation, we will have question and answer period. So thanks again, and congratulations on being willing to listen and save a life.
Great, thank you so much, Pam. Laurie, if you could share your screen.
Can you hear me?
Yes, perfect.
Okay, wonderful. All right, so thank you all for joining us this evening. I was introduced earlier today, I am Laurie Beck. I am the current supervisor of the Cardiac and Pulmonary Rehab program here at Capitol Health. And I'm here to discuss with you the role that cardiac rehab plays in getting you back to your normal activities of daily living following an event, a cardiac event that may have brought you to the hospital. It may have brought you here, it may have brought you to a different hospital, but I'm just going to review with you what we are able to do with you as in the recovery process through that. So let's begin just by talking about what cardiac rehabilitation is. It is a program that provides individually prescribed education and exercise for people with heart disease who are recovering from a heart-related illness, surgery, or other treatment or procedure. So what it is that it is a program where we use the principles of exercise to build your body back up following either a heart attack or a procedure such as a stent placement in the arteries of your heart. We currently are working with individuals who've had repairs to the valves inside their heart or replacements of the valves, as well as people who are dealing every day with congestive heart failure, which is a daily disease that needs to be managed. We also are working with individuals who've had heart transplants. So we have a wide range of heart problems that we can work with. And while using the principles of exercise, we are also providing education. Why did this happen to you? What can you do to prevent it from happening again? What can we do to reduce the risk factors that brought you to a cardiac rehabilitation program? This slide here just goes over again individuals who would be eligible to participate in the program. So anyone who has had a heart attack within the last 12 months, who've had bypass surgery, who have heart problems, maybe the arteries inside of their heart tend to spasm. They don't have blockages that are big enough to be treated with a stent or with surgery. And so they, on a daily basis, are managing what we consider to be stable chest pain. Individuals who have replaced their valves or had them repaired. Stenting of those blocked arteries that Pam had discussed early on in her presentation. She showed you a picture of a heart and the arteries that feed the muscle of the heart that bring it the oxygen that's carried through your bloodstream, the nutrients that you get from your food products, that's all carried through your bloodstream. And the heart muscle, being a muscle and needing to do its job, it needs its own supply of blood. So one of the procedures that can be done is to go into those blood vessels of the heart and insert a stent to stabilize where the blockage is and to restore blood flow to the muscle of the heart. Heart or heart and lung transplant patients, and then those who deal daily with stable chronic heart failure. The cardiac rehabilitation team is multidisciplinary. What does that mean? It means that we don't think that as registered nurses, we have the answers to all of the questions that you may have. So we work as part of a team that includes physicians. So the physicians that you see, your cardiologists, we can work with them. We work directly also with your primary care physicians. Maybe they're sending you there because you unfortunately had an event that was out of the area. And so we don't have direct access to your cardiologist. Of course, we have registered nurses on staff with us. We have an exercise physiologist. We also have a registered dietitian as part of our program, and she meets with everybody at least once, usually multiple times. And through this team, we meet and discuss each individual patient and try to identify what is it that you need in your life to recover from what just happened to you. What is it that's important to you? What are your goals? What would you like to achieve at the end of the program? And we also try to identify the things that we think maybe would be important for you to recover from the event that just happened. Capitol Health here, we do have the cardiac rehab, obviously, and currently we have two phases or two different aspects of a cardiac rehab program. The first phase would be the inpatient side. So you recognize that you are having a problem with your heart. You called 911 so that you came via the ambulance and the team was waiting for you at the door and also beginning immediately in the ambulance to make you feel better. You came here. Maybe you had a heart attack. They did a catheterization. They identified that you had a stent, placed the stent, and now you're up on one of our nursing floors and you're recovering. That would be when we would come in to meet with you and just talk to you. What happened to you? Do you have some questions? The phase one part of it is really supporting of the nurses, the wonderful nurses that are on your floor taking care of you. And then we have the phase two or the outpatient side. And that's where we would begin to work with that team of professionals that I mentioned earlier to design a program for you that's going to meet the goals that you have identified are most important for you in your lifestyle. So again, phase one occurs while you're in the hospital. It's a strictly educational phase. As far as getting you back moving again, having you get out of bed and walk around your room, that's all handled here by the physical therapy department. So what we do is we come up and we just talk to you. We would talk to you, any visitors that you may have that may be in the room with you, maybe a family member is there. And what we like to do is go over the risk factors for heart disease. Why are you here? What happened to you? And then also to answer your questions, you know, do you need any other procedures done? Are you being transferred to another facility because we're not able to provide what you need here at Capitol Health? But we also then review the outpatient program so that when you go to your cardiologist, it's something that you're familiar with. Oh, I heard about that program when I was in the hospital. Is there something that I can answer for you so that when the cardiologist says, I'm going to give you a referral to cardiac rehab, you have an understanding of what it is that he's talking about. And as I mentioned earlier, one of the big things that we do in the education part of it is to go over your risk factors. And I know that Pam had discussed this earlier. These are the ones that the American Heart Association has identified. Your family history. So there is a very strong genetic link. If someone in your family, immediate family, has had a heart attack or has heart disease, then there is a chance that you would develop it because of the genetics of your family. Men are slightly higher risk than women until women reach the age of about 55, 60, and then the risk tends to level off. Unfortunately, as you age, we're at risk for everything. Tobacco smoke, whether you're actively smoker or you live with a smoker, can put you at risk for developing heart disease. The good news with tobacco smoke is once you eliminate that from your lifestyle, whether you stop smoking or you are living with a smoker and that person has stopped smoking, your risk declines. And after a certain period of time, it's non-existent. It's no longer a risk factor for developing heart disease. Cigarette smoking in particular is treated as an addiction. It's not a habit. It does have a habit to it. So if it's something that you struggle with on a daily basis, there are supports out there for you if you reach out to your primary care physician. It's easy for us to say, oh, just stop smoking, but it is one of the more difficult things to try to eliminate from your lifestyle. If you have diabetes, that puts you at an increased risk for developing problems with your heart as well as high blood pressure. Elevated cholesterol levels, so that would be your total cholesterol or your LDL, which is your low density level cholesterol. L for lousy, that's how we remember that one's bad for you. An inactive lifestyle, being overweight or classified as obese. And then if you identify that you have a high level of stress in your lifestyle, the more of these that you have, the greater risk you have for developing a problem with your heart or heart disease. So when we come to see you and you're an inpatient part of your program, we're just going to go over those risk factors. You know, well, how did you get here? What brought you here? Is there something in your lifestyle that you could identify and say, yeah, I think that may have played a role in that. We go over that with you. We give you some educational materials to take with you on your way. And then we just, say, if you're interested, give us a call, or if your doctor wants you to come, then we'll reach out to you. The phase 2 side of the program, which is the one that when you see later, you'll get to actually see some pictures of our gym here. That is the process that occurs after you've been home following your event. So you've come in, you've had a heart attack, they placed a stent, the doctor sent you home and said, come see me in 2 to 3 weeks. And during that follow-up appointment, the conversation may happen where the cardiologist will say, I think that you could benefit by participating in a phase 2 cardiac rehab program. And what it is, as I said earlier, is education and exercise. Patients typically attend the program 2 to 3 days a week. When we meet with you for the first time, we go over the program with you. We do our own assessment. We listen to your heart and lungs. We measure some other things, body fat, your weight, body composition. Based on the first visit, we would determine 2 or 3 days a week what works best for your schedule. And as far as how many times that you would come, meaning a total amount of visits, that would depend on your current health status after we met with you. Medicare supports the cardiac rehab programs, and they say that you can have up to 36 visits for a cardiac event. So if you were to come 3 days a week and you needed all 36 visits, that would take you approximately 3 months. We don't necessarily have everyone come 36 visits. Not everyone needs that amount of cardiac rehab. That, as I said here, is determined based on your goals, the current health status that you are, and what the doctor feels would be best suited for you. When you're in a cardiac rehab program, we use telemetry monitoring to monitor your heart rate and your rhythm. It's a very small monitor. It's only 3 leads. This picture here shows a little bit more, but it's able to send a signal to us so that we can continuously watch what's going on with your heart rhythm and your heart rate. We check your blood pressure at rest when you first come in, and we check it usually while you're exercising to make sure everything's going okay. For those that have diabetes, we do some blood glucose checks on you. We check it before and after exercise, because exercise and activity is one of the ways that you can actually keep your blood glucose levels in check, or in an acceptable range that's good for you. We also have the ability to check your pulse ox, or your oxygen levels in your bloodstream, if we find during our assessment that you have some lung disease in your lifestyle. Then we would want to check that and make sure that we're keeping those levels where they need to be. As I said earlier, we do a complete assessment on you. We do your body composition, and the device that we use for measuring that is listed up there in the upper corner. It's called an InBody, and it's able to tell me what % of your body is good skeletal muscle tissue, meaning your bones and your muscles, your organs, and what part of your body is strictly fat. And not only can it tell me that, but it can tell me if you carry your fat in your stomach, which is not a good place for it to be. What is the weight composition in your legs or your arms? So we're able to take a look at a lot of different aspects of your body by using that device. Everyone gets an individual dietary consult with the dietitian. So she would meet with you, go over a food record with you that's included in the program, and then she's available to you the entire time that you're exercising with us. We also talk to you about any social or emotional concerns that you may have as a result of what happened to you. And we do something called a 6-minute walk test to just get a basic idea of what your fitness level is right now. Some of the cardiologists like to do a stress test on you before you come in. And even if they do a stress test, we're still going to do a 6-minute walk test, because we want to see how you walk. We want to see, how you feel when you're physically moving around. After we do the assessment, then we begin to work on what are we going to do with you in the program? How are we going to use these principles of exercise to make you feel better and to give you the confidence to go back to your regular routine? Maybe before you had your heart attack, you were exercising at your local fitness club, your local Planet Fitness or Urge or something, or maybe you were just taking walks outside and you don't really have the confidence, excuse me, because of what happened to you. So from the exercise side of it, excuse me 1 second, we use the principles of FIT, which is how often are you coming? How hard is it that we're exercising? How long do we want you to exercise? What type of exercise are we going to do? And then what do you enjoy for exercise? The goal for everyone, whether you've had a heart attack or not, a fitness goal for everyone should be that you're going to be physically active for 150 minutes per week. Now that might sound like a lot of time, but if you break it down into just 5 days of the week, that means 30 minutes every day you're going to go do something. This is the recommendation from the American Heart Association and the American Cardiology Association, because they have found that this is the minimum amount of time that you want to do to protect your heart. Why do they say that they need you to be active? Because if you look at the benefits of exercise, with just being active for 30 to 40 minutes 5 days a week, you can have improvement in your blood sugar levels, which would then address your diabetes. It could lower your blood pressure at rest and your resting heart rate. It definitely improves cholesterol levels. Excuse me. Exercise has been the only thing proven right now to increase your good cholesterol. It strengthens your heart. In the beginning of the program, we said that your heart is a muscle and it has one job, which is to pump the blood throughout your entire body. Think about how large your body is. Think about all of the blood vessels that are inside of your body. Your heart has to push that blood around. And the beautiful thing about your heart is if you have a heart attack and it does cause a small area of damage, it doesn't necessarily mean that your heart isn't able to recover from that. So with the principles of exercise, we can strengthen the heart muscle. It improves your immunity. People have reported that when they exercise on a regular basis, they feel better about their stress levels because they can take themselves away from what's stressing them, or they can work through it as they're exercising. Exercise, excuse me, releases endorphins into your bloodstream, which usually improves your mood. And people who exercise on a regular basis do report a more restful night of sleep. So that is the reason why we use those principles of exercise. And if you take a look back at the risk factor screen, the only ones that exercise doesn't really affect would be those first three. Those first three, family history, gender, and your age, are really ones that you can't change. They're going, if you have them in your lifestyle, then they're present for you. But remember, I said that exercise lowers your glucose levels, so we're helping to manage your diabetes. It lowers, excuse me, your blood pressure. It affects your cholesterol levels. An inactive lifestyle is something that will put you at risk. So now you're active. If you can control the amount of food that you're eating or decrease the amount of calories that you're eating and then increase your activity level, you're going to see changes not only in your weight, but in your body composition. And remember, I said we measure your body composition to see. We want more healthy muscle in there. And then we talked about stress a little bit. Now, a lot of times I get a question, well, I don't understand how it helps me with tobacco smoking. If you are feeling the urge to pick up a cigarette, if you take a walk, I don't know too many people who can walk at a really good exercise pace and also smoke a cigarette. So how we use the principle of exercise to address that risk factor is to say when you feel the urge to smoke, take a walk. Okay. Now that 150 minutes may seem to be overwhelming, but it can be broken up into 10-minute segments when you're exercising on your own at home. How we use that in the cardiac rehab is that we slowly build you up to doing about 40 to 45 minutes of exercise while you're in the program. If you're coming 3 days a week, that's 120 minutes that you've done in just 3 days. So you just have to find another day to take a 30-minute walk. And so we start to build in to your regular routine this exercise program that we hope that you'll continue when you're done coming to the cardiac rehab program. As far as the educational topics that go, we have certain ones that we feel everybody should be aware of. We go over signs and symptoms of a heart attack, and you'll see here on the side, I also put in there the things that you should be looking for: the chest discomfort, the arm or back, pain or discomfort in your neck and your jaw, trouble breathing, feeling lightheaded or breaking out into a sweat, and then feeling some discomfort in your stomach. We go over your risk factors, individual risk factors. What put you at a high risk? What can we do to address those? We talk about exercise, and we go over how you can continue this on your own at home. If diabetes is something that you're managing, we measure your blood glucose levels before and after exercise. And we try to figure out, when you do this amount of exercise, how much is your blood sugar changing, so that you can keep that in your head that, oh, when I take a 30-minute walk, I get 50-point drop in my blood sugar level. And that's really good for me because it keeps me in the ranges that I should be. We do all of this education, or as much of it as possible, while you're exercising. So we're optimizing your time while you're in the exercise space. As far as what we have here and what we use for equipment, we were fortunate enough in the summer of 2019 to move into a brand new gym, and I'll show you a picture of that later. And so we were able to increase the amount of equipment that we have. We absolutely use treadmills and we use bicycles, but we also have now available to us some additional weight machines to keep your muscles strong, a rower, an elliptical. We have free weights, we have the new steps. And so based on what your interest is or what we feel you would be best benefited by, we will design an exercise program using these different pieces of equipment. And then, as I said, while you're exercising, then we're talking to you about what you need to do to be healthy moving forward. Excuse me. This is a picture of our gym. We are very lucky. I like to say that we have the best view in the entire hospital because our space is now completely windows all the way around. And at this time of the year, we get some beautiful sunsets. Excuse me, because of the current pandemic situation, we are practicing social guidelines. We are only allowed to have 6 people in the room at a time, which, as you can see from the picture, we have many more treadmills than that, but we have figured out where each patient needs to be safe in the room. The staff, of course, are practicing the safety protocols of wearing face shields and then masks while the patients are exercising. And we have the patients clean the equipment when they're done, which is something that we were doing even before this virus came and changed everyone's lives. But we are also then at cleaning the equipment on a regular basis as well. And so the important thing to remember in the American Heart Month is that you want to always keep your heart strong. You want to think about your heart. Your heart does its job, and for the most part, doesn't really need a lot of attention. When it does need attention, you don't want to ignore it. You absolutely want to get some medical attention by calling 911. And then if you do have an event, then come see us and we'll try to make you feel better and give you the confidence to get back out there and continue with your activities of daily living. So thank you.
All right, great. Thank you so much, Laurie and Pam. Before we move into Q&A, I just want to remind everyone that we have a survey up. Your feedback is very important to us. So that's in the chat box right now. So you can just directly click on that link to access the survey evaluation. So if you have a question, please feel free to unmute yourself and ask your question.
Megan, I do have a comment. I have been up in the wellness center where Laurie works, and I have to tell you that they do have a stunning view, and the whole gym space has such a good, relaxing vibe. Even though there are people there working out, it's just a really good place to be, and it's very relaxing, despite the fact that they're doing exercising up there.
I'll have to agree with you. I've been up there a couple times myself. It's very nice.
Yes.
Does anyone else have a question? If you don't want to unmute yourself, feel free to just type it into the chat box and we'll bring it up that way as well. Someone asked in the chat box, what are the hours? I'm assuming this is for Laurie.
Well, probably just to give you a little bit more background. So on Monday, Wednesdays, and Fridays, we work with people who need the cardiac rehabilitation program. And currently we begin to work with patients at 6:45 in the morning. And we're here in the evening until 5:30, 6 o'clock at night. And then on Tuesdays and Thursdays, we work with people. We also have pulmonary rehab, and we work with those individuals on Tuesdays and Thursdays, and the hours are the same, 6:45 to 5:15, 5:30. And then we just started this month a new vascular rehab program. And so those individuals would be coming in on the Monday, Wednesday, Friday schedule. Again, fitting into that 6:45 to 5:30 time. So once we do our intake with a patient, we sit down and talk about their schedule and figure out what is the best time of day for them to come in.
Great, thank you for that. Any other questions?
Yes, I have one question. How do you differentiate the symptoms, which can be so similar to viral or cold or any other kind of illness?
That's a very good question. And it's very hard to answer because of course, a lot of the symptoms that we talked about can be related to other things. What you are looking for are things that may be new that you haven't experienced before. And like I said, they may be symptoms that get worse when you're exerting yourself or with activity. They get better when you sit down and relax and rest. Certainly, if you're having viral symptoms, things that you may think, such as nausea, discomfort in your stomach at all, anything that you think might not be heart related, you could call your physician. If they have any concern at all that this might be at all related to your heart, they're going to probably send you to the emergency room or call 911. And I think the key is that it's hard to differentiate those things. It's a very difficult thing to say. We have people that come to the emergency department that will be complaining of shortness of breath, and they feel achy, and they may come because they are afraid they have COVID-19. And once the physician examines them, it turns out that really what is happening is they may be having a heart attack. So that's why it's so important to act on those symptoms, because it's really hard to differentiate between that. And you always want to err on the side of caution.
Thank you.
Mm-hmm.
Here it goes. Can I ask? I did have a question. I did put it in the chat box, but I saw how to get my thing up. Do you believe, or do you feel that if somebody feels some discomfort or pain, they should take a baby aspirin immediately?
Baby aspirin is very good. That it is good advice to do that. And oftentimes when you come to the emergency room complaining of chest pain, that's one of the first things they'll do to you. They'll actually give you 4 baby aspirin and you chew them up. EMS will also do that when they arrive at your house if they're concerned. As long as you're able to chew and swallow without any difficulty, if there's nothing that would contraindicate that for you, if you don't have a history of GI bleeding or anything like that, there are certain people that can't take aspirin, but I would imagine that they are aware of that, hopefully, that they've had that conversation with their doctor. But yes, the thing is that it's not enough just to take the aspirin.
Right.
You have to, the aspirin is a good thing to do while you're waiting for 911 to come.
Okay, thank you. I had heard that, but I didn't see it on your list of items.
Yes, I don't, aspirin is one of the first things that they will give you in the emergency department. And certainly if you take it at home, would not be a bad thing to do. Chew it up.
It's odd because I know over going to my doctors over the years, the doctor said he didn't see a benefit for women taking a daily baby aspirin, but the men seem to have that automatically.
Well, taking a daily baby aspirin is a different thing.
Okay.
Certainly in the setting of something acutely happening to you.
Right.
A daily baby aspirin has risks and benefits that your physician will weigh for you and see, is it good for you? Because when you take aspirin on a regular basis, it can cause you to have some GI upset, or sometimes it can cause bleeding.
Right.
So they want to look at, do the risks outweigh the benefits? And it varies not only from male to female, but person to person.
Okay, thank you. That was very helpful.
Okay.
We have one question in the chat. If you have blocked arteries with cholesterol, is there anything besides a better diet that can reverse the situation? Also, how would you know without having an episode if the arteries are blocked?
Laurie, do you want to talk about reducing cholesterol with exercise?
Sure. So a few years ago, there was a study done that demonstrated that a lifestyle that includes regular exercise, diet modification, as well as meditation. So a pretty serious amount of stress management that was shown to reverse the size of blockages in the heart. But there isn't a whole lot you can do without changing your diet, and or for some people being on medications, because cholesterol is not only found in the food that you eat, but it's made by your liver, which is why if any of you are on cholesterol medications, your physician will say, I want you to get this blood test done and we're going to check your liver enzymes, because the medications are actually working inside of your liver to slow down that production of cholesterol. And cholesterol gets a bad rap sometimes. You have to have it to be in your body. Your body doesn't make, things that it doesn't necessarily need. You need it for cell production and for hormones. But as with everything, as you age, we don't need as much of it as maybe when we were in our early 20s. So a combination of those things has been shown to reverse heart disease, but it's a very specific lifestyle that you have to follow. And there is a very huge component with diet in there. And it's a vegetarian-based diet that would reverse those cholesterol levels. And as far as how would you know if they were blocked without having an episode, the only way to really know what the size of the blockages are in your artery is to have a cardiac catheterization. That's the most definitive way to know what's going on with the arteries of the heart. You can have a calcium score done, which would just let you know if there's any hardening of the arteries. But to know the exact location of the blockages and how big they are, you would need to have a cardiac catheterization done.
Okay, thank you for that. Are there any other questions? If not, okay, thank you all for attending, and thank you both Pamela and Laurie for speaking tonight. It was very informative.
Thank you.
Thank you.
Good night.
Good night, everyone.
Take care.
Good night.